Welcome, everybody. I'm Beth Cranson with Media Relations at Spectrum Health. And today we have 3 doctors here who are going to talk a little bit about what we're seeing at the hospital and within our system. And then we'll give you the opportunity to ask questions. As always, please just put your questions in the chat, and then we can call on you as they are received. First off, we have Dr. Nicholas Kuhl, who is the Medical Director of Adult Emergency Medicine at Spectrum Health. Then secondly, Dr. Erica Michaels, who is the Associate Medical Director at Helen DeVos Children's Hospital's Emergency Department. And Dr. Rima Shah, who is the Department Chief of Primary Health. So go ahead, Dr. Kuhl.
Thank you. Thank you for joining us today. I wanted to give you a brief understanding of the state of the emergency departments for Spectrum Health West Michigan. It's been a very busy August and September, and our staff and our patients are noticing it. You know, earlier in the pandemic, we had lower numbers of patients arriving to the ER. This was during the time that there were stay-at-home orders, people were masking, and even patients were delaying care. Since January of 21, we've had a steady rise in the number of patients coming to our emergency departments month over month. And beginning in August, we returned to our baseline pre-pandemic volumes. Currently, as I look back the last couple of weeks, some of our departments in Spectrum Health West Michigan are 5, even 30% above the baseline numbers of patients needing our care. It's a challenge to our departments, but one that we're up to. The patients that are coming to us are sick and they need us. As I look at the acuity, how severe the illnesses that we're seeing, the proportion of our patients that fit a highest complexity or even critical care level is up 20% these 12 months versus the year prior. And so we're here to let you know about our departments, let you know that we're here for you when you need us, but also to make you aware of other aspects, other access to care when appropriate. Erica, I'll give it over to you.
Are there any questions, first of all, that you have specifically for the PEDS world?
Don't see any questions just yet, Dr. Michaels. So
okay.
You could probably just paint a quick overview of the situation for us, and then we'll jump into those.
Sure. So at the pediatric hospital downtown at Helen DeVos Children's Hospital, we are seeing for the first time a big surge in cases since the pandemic started. And again, I think people are out and about, and children are being exposed to viruses that many of them haven't been exposed to for the last year and a half. So we're seeing a huge increase in our pediatric volume, both in the emergency department and in the inpatient spaces. I would echo what Dr. Kuhl said. We're here for our community. If you believe that you have a sick child who needs urgent care for an illness or an injury, we're the right place for you to come. However, if you need a COVID test so that your well-appearing child can go back to school, we would ask that you access the many available community sites for COVID testing. And we want you to understand that you may need to exercise more patience than in the past when you visit our emergency department. Every patient will be triaged upon arrival. And if your patient is, or if your child is not urgently in need of medical assistance, you may have to wait to see a provider, and that wait may be longer than what you've been accustomed to in the past. But understand that we care about you, we care about your child, and we will get to you. But if your child is stable, you may have to wait to be seen, and we certainly appreciate your patience in helping our staff with that.
Dr. Shah, did you want to jump in?
Go ahead, Dr. Shah.
Yes, absolutely. Thank you, Erica. I think it's so important to really look at our other options of seeking care so that we don't overwhelm our emergency department. Of course, the ERs are there for anything emergent, but for any other needs for our patients in our community, We have resources in our primary care offices, in urgent care facilities that we have within Spectrum Health, and also we have virtual capabilities that are available to us. So any urgent issues that need to be taken care of, we have on-demand service, which is available 24 hours, 7 days a week, all through the year. It's very, very easy to access our on-demand urgent care services in virtual ways, and also taking primary care help for those issues and conditions that can be seen by a primary care provider who can see you in person or even through virtual capabilities. And those would be some of the ways so that we don't, we leave access in our emergency departments for the things that are emergent and for the patients who really need to be seen. And another example, like Dr. Michaels mentioned, was testing that really should not be in an emergency room. We can do that by contacting our primary care providers, other community resources that are available, connecting through virtual capabilities, reaching out through your PCP or downloading your Spectrum Health app and going into Nitro. And that's
Hey, Dr. Shaw, sorry to interrupt you. Can you check your mic really quick? I think people are having a little issue hearing you. Just wanted to make sure that it's right there, not covered or anything.
all right. Can you hear me?
That's much better. Thank you.
I don't know if you guys heard anything I said, but I think the main message that I'm trying to share here is that there are so many other resources and services within Spectrum that we can provide for the right care at the right location. So we're not going to the ERs for things that can be taken care of by your primary care providers or by urgent care, and in virtual. We have so much access available to our virtual capabilities that can be accessed not only by our patients within Spectrum Health, but also our community patients who are not really our patients yet, and they can even access our virtual capabilities. And then testing, there are ways that they can reach primary care providers, our Spectrum Health app that they can go in and get on-demand services through virtual as well, so that we can send the patients to the right location for care for the right reasons.
Thank you. The first question comes from Keely. Go ahead, Keely.
Hi, everybody. Thanks so much for doing this afternoon. Yeah, we just kind of wondered if there was an increase in wait times in emergency rooms, and if so, or I guess any increases, if so, how long or by how many patients, I guess.
Sure. So I could answer that from one perspective. The emergency departments use a triage process to sort patients by the severity of their illness or injury. And so patients with a serious medical condition are brought back first, while patients with minor problems sometimes do have to wait. We have fast track structures to get rapid care to patients even with those mild to moderate illnesses, but we do appreciate grace right now. With the volume of patients arriving at our departments being higher than baseline, and the admissions to the hospital being higher than the baseline, taking up some of our beds, it does take longer to work through everyone that comes to our department. Our door to room time, what used to be 5 to 10 minutes, maybe 10 to 20 minutes now on average. But there are times when it can be much higher than that during surge. And patients may have to be in our waiting room for even a couple hours rarely. And I will say that we have enough providers, enough doctors, enough nurses to see everybody. But in the current surge, those numbers are a little longer for some patients.
Thank you.
Let's see, the next question, Marisa Oberle. It's sort of been answered by Dr. Kuhl. I guess we should also let Dr. Michaels talk a little bit, I'm sorry, about what we're seeing at HDVCH.
About wait times, Erica? I think.
Yeah, I didn't know if the news person was going to hop on, but I can read it in the chat, so that's fine. So in terms of the increased wait time at the DeVos Children's Hospital, we generally have a door to dock time of under 10 minutes in our emergency department. But as Dr. Poole pointed out, during surge times, that may be significantly longer, and it's really variable depending on when you come to the emergency department. We tend to be much busier in the evening and have fewer patients to see in the morning hours, for instance. The things that are bringing children to the emergency department right now are really wide and variable. We're seeing winter viral illnesses that make kids sick that hit right around the 4th of July weekend. So we've got all of the typical summer viruses still circulating, and now we have all of the winter viruses circulating too. So lots of little kids out there with difficulty breathing and high fevers and maybe inability to tolerate oral liquids and getting dehydrated. We're also still in the midst of our trauma season. The weather's nice outside. Kids want to go outside and play. There's lots of sports teams that are active right now. So we're still seeing lots of broken arms and broken legs and kids who need to be seen from a trauma standpoint. Generally speaking, those virus surges are much more reliable in our pediatric space. But because largely our community has stopped masking and is circulating more frequently, we're seeing kids getting sick with those viruses at a very odd time of year. And we anticipate that this may get more significant for kids before it gets better as we head into our winter months, where at least in West Michigan, we're all inside because it's cold outside.
Thank you. And Dr. Shaw, could you add, given what Dr. Poole and Dr. Michaels have just said, maybe some of the sorts of conditions and that would be appropriate for somebody to seek virtual care as opposed to ending up in the one of our emergency rooms?
Yes,
please stay close to your mic.
Yes, so please let me know if you can't hear me well. Yeah, any urgent issue which really can wait for 24 hours, it's really not an emergency. Mild asthma flare-up, a rash, sore throat, cough. Those are the kinds of things that you really don't need to go into the emergency room for. It can be seen in an urgent care. It can be seen by a primary care provider. Or once again, the primary care provider can see you in person, or they can see you through virtual needs, a virtual video visit, which is 24/7, our on-demand services. And it is very easy to get access to that. You have to download the Spectrum Health app, and then within just a click, you can get urgent virtual video visit within 10 to 15 minutes of wait time. So those are the kind of things, anything that you can think of, which means within 24 hours, it's not an emergency. For ER visits, and of course testing is one thing that I mentioned earlier, is really can be done in other venues and doesn't need to go to the emergency room for. Stroke symptoms, chest pain, moderate asthma flare-up, fractures, those are the kind of things that you want to go into the emergency room for. But the others, you can really deflect it to your primary care providers or to urgent cares.
Thank you. Marisa, do you have another question, or did you need someone to elaborate on your question about wait times?
No, I think that kind of handled it. I don't know, though, if it was more formally answered, though, if you guys have more specific numbers about the increase in ER and regular visits at Helen DeVos. I know that it was mentioned, some of the numbers surrounding, adult emergency room visits were mentioned, but I know you said that you guys are seeing the first surge in seeing patients since the pandemic with an increase in ER and regular patients, but I don't know if you have a more specific number besides just an increase in seeing that.
Absolutely. So I think just it might be easier to understand if we would say, this time of year at Helen DeVos Children's Hospital, we're usually seeing about 160 patients a day. And we're currently seeing more like 200 patients a day, with some nights surging up to 220 to 240 visits per day. So that's quite an increase in volume for us. And while the Children's Hospital tends to surge very well because we do see these big waves of viral illness that hit children in our community. We're surging at an odd time of year for us, and we're also surging in the midst of a nationwide nursing shortage. And that's really driving our difficulty to surge as well as we usually do. And so we have the capacity to see patients. We're really good at the Children's Hospital at surging up to meet our community's need. But this time we're doing it with some handicaps in terms of our nursing staffing and our nurse tech staffing. And that is complicating what is generally a well-oiled machine at the Children's Hospital.
How short-staffed are the hospitals right now, and how is that impacting what you guys are seeing?
Mm-hmm. So there's a nationwide nursing shortage going on, and that's affecting both the pediatric hospital and the adult spaces. And so we have, we largely have physician providers available, but healthcare is absolutely a team sport. And if we don't have enough nursing colleagues and enough nurse tech colleagues there to help support that work, it complicates work. It makes things take longer. And it stresses the staff who are present. And so we certainly are concerned and aware of the risk for staff burnout during times of surge.
Dr. Kuhl, do you have anything to add?
Well, I don't have a specific number. I know that our team at Butterworth and other ERs is covering more patients per nurse than they might normally at times. Providers are stepping up, techs are stepping up, and everyone is doing a little extra. So instead of like a phlebotomist coming to draw your blood, the nurse is drawing your blood now. Instead of environmental services turning over the bed, maybe the tech is, or even a provider. So it's a resilient team, and they're making sure that the people get cared for, but I do feel like the shortage does stretch us further than we have in the past. And we are looking forward to the results of the incentives that Spectrum's been putting in place to try to recruit and retain high quality nursing and other team members. I think that's critical for us to continue delivering the care that we're known for.
Thank you. Brian McVicar from MLive, go ahead.
Hey, I just want to make sure, overall message today is be more deliberate about coming to the ER. And just to Dr. Michaels, what you said about the surge at Helen DeVos, is that or is that not COVID related? Is it partly COVID related or not at all? I want to make sure I'm clear on that. So first question is what's the big takeaway of this event today? What are you trying to convey?
So I do think that we're asking patients to more deliberately think about seeking emergency care, and also more deliberately evaluate the choices that are available in the community, such as their primary care doctor, urgent cares, and virtual options before they come to the emergency department. I think pediatrics is specifically different than adult medicine when you think about who needs to be seen in the emergency department, so I would like to comment on that. Dr. Shaw commented on things like stroke symptoms and chest pain, and that's very important in the adult spaces. When we think about pediatric presentations that require emergency care, absolutely trauma and fractures, the emergency department is always going to be the right place for that. Conversely, if your child slammed their door or their finger in the door and you're worried they may have a broken finger, an urgent care would be a great place to get that evaluated. But if you have a child at home who you feel is having difficulty breathing, they're not drinking and you feel they may be dehydrated or in need of IV fluids, or they have a fever and you feel like they look sicker than they usually do when they have a fever, the pediatric emergency department is going to be the right place to take care of those patients. We don't recommend that small babies and small children with difficulty breathing go to our urgent care centers, because the evaluation of a child in respiratory distress is somewhat different and more difficult than an older patient who may be able to tell you exactly how they're feeling. When we think about what's, oh, I'm sorry, I was going to talk about
okay, go ahead.
When we think about what's causing our surge at the pediatric emergency department, it's really multifactorial. So again, we're seeing viruses surging now that we generally only see in the winter time, like around Christmas. And we're seeing all of our summer viruses surging right now too. So we really have sort of layers of viral surge that's happening right now. COVID is absolutely a player in that. And at this point, I would urge our community to consider personal vaccination against COVID as a public service to the community that you live in. While children do tend to handle COVID better than adults, the COVID surge in our community is absolutely driving some of our pediatric numbers. And then we're still seeing a lot of trauma in kids because the weather's nice outside. And so kids are outside being active and doing what kids are supposed to do. And unfortunately, sometimes they get hurt and need our care.
And what about, yeah.
I was going to say, from an adult perspective, this Delta surge is affecting us. It is bringing more patients to the department, and they are sicker and needed admission, especially unvaccinated patients. You know, since August, cough, fever, and shortness of breath have moved into 3 of our top 5 chief complaints that we're seeing in the emergency departments. We still see plenty of abdominal pain. We still see chest pain, falls, headaches, motor vehicle accidents. And it seems we're seeing even more of those currently. I think the trauma season does affect adults as well. The summertime, we see more of that. And so they're all coming to the department, but we are seeing a significant number of COVID patients that require evaluation, treatment, and sometimes admission. So while we don't desire to be the community's source for screening testing, for exposure testing, for minimal symptom testing for COVID, we do desire to care for those patients that are feeling that shortness of breath, that are too fatigued to care for themselves, that are worried about their symptoms and getting worse. And that's very appropriate use of our space.
Bottom line, you're not full.
No, every day we see every patient that comes to us, we are stretched thin. Our buffers are smaller than they have been in the past, but they're still there, and we're not full.
20 to 30% above average, was that correct?
So it varies department to department. Some of our regional ERs are 30% above average number of patients coming through each day. Helen DeVos is 22% above average. Some of our departments are only 5% above average or even, but it's across the board. We've returned to pre-pandemic levels. We're rising above it, and more of those patients are sicker than they used to be, thus requiring admission.
Thank you.
Thank you. Any other questions from any of the reporters on the line? And any other comments that, as we're winding down here, we have a couple minutes, any other comments that any of the doctors would like to make?
Sorry, I guess just one more thing from me here, Brian McVicker over at MLive. Just we heard a little bit about how much maybe longer the wait times would be at Helen DeVos. Do you have a calculation for what that 20 to 30% or that range translates to at Butterworth in terms of timing? How much longer?
So, you know, average wait time to get back to a room varies by time of day and day of week. We have trended up over the last few months from, say, like a 10-minute door to room up to closer to 25 minutes in this past week on average. Now, once you get to a room, a provider sees you within 3 to 4 minutes. But that's an average. And Mondays, sometimes afternoons and evenings, as alternative sources of care start to shut down, it can definitely get higher. Even overnight, we have patients arriving very late into the evening or into the early morning, and sometimes have to wait a couple hours to be seen.
Again.
Anybody else? Anybody have any additional comments?
I guess what? Oh yeah, go ahead, Erica.
You first.
Well, I was just going to add that even though we're dealing with the surge, we can safely care for non-COVID patients. We don't want delayed care. We don't want people avoiding coming to the hospital when they know they should. We need you to listen to your body. Patients know when they're having an emergency. And like Rima said, chest pain, weakness of your arm, inability to speak, broken bones, like we can deliver care safely to you. And we've gotten good at this. We're good at PPE. We're good at caring for both COVID patients and non-COVID patients.
Dr. Michaels, go ahead.
Yeah, I would just comment that we want patients who feel that they have an emergent need for care to come to the emergency department. That's what we're here for. And we want patients who are unsure or feel like they need to be seen, but maybe don't feel like this is an emergency, to access their primary care physician for great advice. The nursing lines are open and there to answer your questions. Your primary care doctor is available to talk to you and answer your questions. But if you feel that you're having an emergency, we're here for you, and we can safely care for you. But that care might feel and look a little different. There are patients in hallways in the emergency departments. If you need to be admitted to the hospital, that might happen in an emergency department room, and you might stay in that room for the duration of your stay rather than going to an inpatient space. If you have a surgery and you need to be watched overnight, you may be watched in the post-op area for the entire night instead of going to an inpatient space. So we're creative, we're good at this, but we need the public to know that care might look a little different when you come to our facilities, because we are expanding our capabilities and we are trying to creatively solve some of our space and staffing problems. But we're doing that in a safe way. And we don't want people to delay or avoid care and get sicker before you make it to see us.
I would also like to add and echo what Nick and Erica mentioned. We have also, have been thinking about creative ways so that we can open up access in primary care by providing extended hours, by opening up walk-in clinics in areas where we were seeing unnecessary ED utilization, patients going in that could have been taken care of in primary care offices. And then thinking differently, virtual care is a safe option for the appropriate patients that can be seen in urgent care, can be seen in this virtual way 24/7, like I said, so that is available to our community and to our patients to access as well. So primary care option and then virtual is a great option to have those patients be seen for appropriate.
Thank you. Thank you very much. Thanks to the reporters. We appreciate you taking some time to chat with us and helping to spread our message. So thanks very much.